Okay, so here we are, left shoulder on September 28th, 2007, and you are resting on your right side on the surgery bed. But first I examined both your shoulders, and both your shoulders do have a little extra play in them, and both of them kind of go out more towards the back than the front. So I think that's just the way your shoulders are. That's just normal for you. Now you're resting on your right side, so we can look at your left shoulder, and your left shoulder is on its side, with the humeral head up above, the ball of the ball and socket up in here, and then the glenoid, the socket, down below. So humeral head above, socket down below. The scope's in the back of the shoulder looking to the front, and the front is this little blue plastic tube, this cannula, so it can go down out of your shoulder without having to go through your muscles. And we're seeing, just from this brief scan, we're seeing three interesting things. One is some fraying of the front labrum. One is some major fraying of the back labrum. Back in here, what's called a bucket handle tear, where this tissue is actually separated and can catch in the joint like this. And on examining your shoulder, this definitely clicks a lot. So this is probably the major thing going on with your shoulder. Interestingly, you do have a little bit of deep surface rotator cuff fraying, which may or may not be an issue later on. If you have symptoms, that may be something to deal with at a later date for you. But we'll trim this deep surface fraying of this while we're here doing all this. And then, of course, we haven't seen where we think that cyst is, but we'll come to that as part of all of this. So let me just take a tour of the whole joint before we start doing any trimming of these areas. But it's kind of encouraging already to see this, because this looks like stuff we can make you way better with this arthroscopy. So here's your biceps tendon, the long head of the biceps that comes from the top of the socket, supraglenoid tubercle, and goes out through the shoulder and down to the arm, up there, up at the top of the screen. So biceps looks fine. Then it comes past this little frayed labral tissue here to the front of the joint. So here's your front rotator cuff tendon, the subscapularis. All right, if I get past this frayed stuff, right here is the subscapularis. And then right in behind here is where it looked like that fluid had kind of pooled on the MRI, where they thought there was a little cyst up in here. I think I'll see that better when I get some of this extra frayed tissue out of here. I'm not seeing an obvious spot where I think a cyst is, but let me just kind of poke at this a little bit. Yeah, kind of down around the corner here is where it looks suspicious on the MRI, and this is looking way down around the corner. Nothing obvious that you'd call a cyst there, but I think what I'll do is when I come back and shave all this, I can get a better look down there. We'll kind of end up looking for the cyst at the conclusion of all of this. Back to the joint, anterior, inferior glenoid and labrum, a little softening on the anterior front part of the labrum, down to the armpit side of the joint, the extra recess. And then here's where the capsule attaches the head on the back of the shoulder, so posterior-inferiorly. Looking along the back of the joint, kind of nice where you can see a little blood vessel going into the bone that shows how the blood supply comes from the soft tissues and goes into the humeral head. Actually, another one right there, I think. But all that's just normal. That's just normal anatomic variation of how these hook up. So here's all normal rotator cuff. This is sort of how you want all your cuff to look. As we come way to the front, you do have this little deep surface tearing. So you probably did have a shoulder, I bet your shoulder shifted and that caused all this to happen. Sort of the tissues pull so hard on each other that they actually kind of cause a little tearing. And then here's up above the socket, supraglenoid fossa. And then the back of the shoulder. And then again back here then is this posterior bucket handle tear, which is hugely the most significant thing of all this. I'm not even sure if that cyst in the front, if we're going to find one, if that's much of a deal, but this definitely is the main issue is going on with the shoulder, and trimming this out should make a gigantic difference. And that's kind of what the MRI suggested, although this is even much more dramatic than the MRI had shown us. So what I'm going to do then is bring the shaver in. I think I'll start here with this posterior bucket handle tear. So This is the arthroscopy shaver that has a little blade that oscillates back and forth, and so I can kind of pull this frayed tissue into it. And usually it can make pretty quick work of this. Sometimes we have to cut across this, but usually the shaver will trim across this. So what I want to do is detach it and then debride it all the way back to both sides. That's not quite doing that. Let me have the basket, so I'll just snip across that, and it'll be much easier to trim out with the shaver. Since that didn't immediately cut across that, I'm just going to take this snipper and do the cut myself, like that. And then this way, the ends of this will come into the shaver better. So this is the upper end, so your head is over that way. So this is the posterior superior labrum here. Yeah, see, now that it's cut, it's much easier to smooth that off. And interesting, the labrum doesn't bleed, but that little bleeding is just the synovial tissue next to the labrum. And here's the lower back part then, posterior inferior. So this does suggest that your shoulder probably had shifted out to the back. And of course, both your shoulders do that a little bit. But most of the time, these don't need to have an actual posterior fix for instability. Occasionally, yes, but mostly no. Right down to there. And then you get this little bit up here. So anterior superior labrum, and then superior labrum here. And this on the other side of this is where, if there is that, if that is a little synovial cyst, we should get down and look at that. But I'm going to come up and get this vice, or the rotator cuff part first. Right there. So hold that for a second. So this is this little undersurface flat tear of the supraspinatus, and it doesn't hurt you to take this off, because even if we end up ever having to fix your cuff, we couldn't use this. When it flaps back like this is not tissue that's of use anymore, and so it's not actually weakening your cuff to trim this off. It helps us take out anything that's catching in the joint, basically. Here, a little bit there, like that, and then let me take the hook first and I'll look at those things, then we'll come back and see if there's anything about this cyst, or if we even actually see a cyst per se.